Chris, we'll go ahead and get started. Good morning, everyone. Thank you for joining us today. As always, we are happy to have Jennifer Brush with us here for our monthly brain health series. If you have not met me before, my name is Marla Gordon. I'm the Director of Clinical Services here at Kendal at Home, and we're pleased to have you with us. Jennifer will be sharing slides today, so you should be able to see her presentation on your screen and us on the side of your screen. You should not have to make any adjustments to your view. Throughout the presentation, if you have any questions for Jennifer, feel free to click on Q&A or chat at the bottom of your screen and enter those questions, and she'll be happy to address those for you. Jennifer, thank you for being here with us today to talk about the common challenges related to dementia. Jennifer's worked with several of our members that have dementia and their families, and she is a speech pathologist by training and also the Director of Brush Development and a Fulbright specialist. I know I won't do credence to her many accomplishments. I'll let Jennifer say a little bit about herself before she gets started, but thank you for being here this morning.
All right, thank you, Marla. And thanks for everybody who's joining us again. I think it's really important to talk about brain health. It's important at any age. It's not something that we should wait until there's a problem to do something about. And there's a lot of things that we can do to prevent dementia in the first place. But today we're going to be talking about some of the common challenges that you may be experiencing as a care partner if you're living with someone who has dementia, and how you can understand a bit more why those things are happening, and then specifically what you can do about them. As Marla mentioned, I'm a speech language pathologist by training. I've worked with Kendal at Home for many years now and have really enjoyed the experience of not only collaborating with the care coordinators, but really getting to know a lot of the members and to provide support for those people who have some kind of cognitive impairment. I'm a researcher in the area of Alzheimer's disease and neurocognitive disorders, and I specialize in looking at how the physical environment can be modified to support people who are aging and people who have dementia. I also use the Montessori philosophy to help people who have cognitive impairment to stay engaged in their life. And I'm the program director of Montessori Education for Dementia at St. Nicholas College in Dunleary, Ireland. So today we are going to discuss changes in the brain that may cause people to experience memory, visual, or language difficulties. We'll talk about some of the ways people might act because of those changes. And then we'll also talk about what you as a care partner can do to help make the day go better. It's best for me if I take questions at the end, just because of the view that I have on my screen. When you write in the chat, I don't see it as I'm talking because I'm just looking at my slides. So I'll make sure that I save plenty of time at the end. And if you'd like to have any discussion, we can certainly do that. So if you know someone or live with someone who has dementia, you've probably observed some of these things before. They may forget the names of common objects. They may call you by the wrong name and think that you were someone else. They might refuse to take a shower or say they have already taken one, even if they haven't. They might see or hear something that isn't there. They may tell a story that isn't accurate or wear the same clothes. So why does that happen? Well, during dementia, the cells lose the ability to communicate with each other. And because of that, they eventually die. And this loss of nerve cells causes the symptoms of dementia. So, for example, memory loss is caused by this loss of nerve cell. And the brain basically becomes unable to function in its usual way. If you look at the brain of a person in the latest stages of dementia, it may be only a third of the size of the brain of an individual without dementia. So there's protein clusters known as plaques that gather between nerve cells, and twisted strands of protein known as tangles that gather inside the nerve cells. These protein clusters that gather between the nerve cells are called beta amyloid plaques. And the plaques and tangles begin to form in areas of the brain where memory, learning, and thinking occur. And this continues to affect other parts of the brain, causing damage to the brain and also to the nerve cells. The damaged areas of the brain include areas such as the hippocampus, which is the area of the brain that helps new memories to be formed. Damage to the frontal lobe of the brain eventually causes problems with intelligence, judgment, and behavior. And then damage to the temporal lobe affects memory. Damage to the parietal lobe affects language. So as individuals have nerve cell death all throughout the brain, in different lobes of the brain, we begin to see different symptoms. So nobody really knows what causes Alzheimer's disease to begin, but we do know a lot about what happens in the brain once it begins to take hold. So these are PET scans, and they demonstrate the difference between a normal brain and the brain of a person who has Alzheimer's disease. In a PET scan, you see areas of yellow and red, and they indicate mental activity. Shades of blue or black indicate reduced or no activity. So you can see this is really a significant difference. There are a number of visual perceptual difficulties related to dementia that an individual might experience. There's a decreased sensitivity to differences in contrast. So that means that people need more contrast and to be able to differentiate one item from another. There's a reduced ability to detect movement, changes to the visual field. They may not be able to see different colors very accurately. There's changes in the reaction time of the pupil to light. So the pupil reacts much more slowly when you're going into an area of light, from dark to light or light to dark, okay? There may be problems focusing, directing, or changing gaze. An individual might not recognize a face or an object any longer. They may see an object and recognize it and not be able to see it, or see something clearly, but the brain interprets what it is incorrectly. There's also problems with depth perception. So people think of Alzheimer's disease or other types of dementia as a memory problem, but there are a number of visual perceptual difficulties that are related to the disease that are very difficult for people to manage. So one thing that that people experience a lot are illusions. So that's when what the person sees is actually a distortion of reality. Okay, so that's an illusion. A misperception would be what the person sees is just a best guess at the inaccurate or distorted information that the brain has received from the eyes. And then there's misidentifications. That's when there's damage to specific parts of the brain that can lead to problems identifying objects or people. So for example, looking at a pen and thinking that it's a cup. Okay, that would be a misidentification. Now, people also have hallucinations. That's when they see, they hear, or they taste something that isn't there. Hallucinations can occur through all of the senses. Visual hallucinations are the most common, and that can be as simple as seeing a flashing light or as complex as seeing a bizarre situation. You know, I worked with one person who saw a Mack truck driving in the living room window, cars coming at them while they were driving in their lane that actually weren't there. And so people with dementia often, you know, the hallucinations are very real. So they feel very real. It's very difficult to explain to somebody that that's not going on. And what also happens is that people with dementia are often thought to be hallucinating when in fact they're really making a mistake about what they've seen. So if we go back to the visual perceptual difficulties, it could be a distortion of their reality. It could be a misidentification instead, rather than an actual visual hallucination. Their brain could just be interpreting the information incorrectly. So sometimes these are not bothersome at all to a person. Sometimes they can be really scary. A person can't tell, the brain can't tell, they are unable to tell that it's not real. So what do we do? First, determine if a response is even needed. Is it bothering the person? If it's not bothering the person, you can have a pleasant hallucination. So you don't want to call attention to it. Just know it, realize what it is, accept it's a symptom of dementia, and just be thankful that it's not causing any distress. So if the hallucination's upsetting them or causing them to do something unsafe, then it's time to step in. It's very hard to argue or convince or use logic when someone's having a hallucination. So it's important that you stay calm and that you don't contradict them, because what they're seeing is very real to them. So if you try and explain it that it's not real, it's just not going to work. And you're just not going to be, you can make them even more agitated. So if they're calm enough, ask them to explain what they're seeing. It might help you to understand. Listen carefully, try and pick up some cues about what they're seeing, and validate them, reassure them. Don't brush it off. Don't say, don't be silly, there's nothing there. Okay, this must be really scary for you. I understand that you're concerned about this. What can I do to help? Okay. If it's something happy, you might just say, how wonderful. I'm glad it makes you happy. Or you might want to say, I see that you're worried. You sound worried. What can we do about it? Okay. So if they see someone, for example, outside the window, you could say, it's okay to say, I don't hear or see anyone out the window, but you seem very worried. What can we do? What can I do to make you feel safe? Okay. And then what you want to do is look around the environment, because they can interpret signs or sounds differently than we do. So you might want to look to remove possible triggers. Something from the TV or the radio could make them believe that there's strangers in the house. Dim lighting could make them see shadows, and a shadowy corner could make someone be afraid. They might see a reflection in the floor or a reflection in the window when it's dark outside and bright inside, and that could make it seem like there's someone in the house. Okay, mirrors can be another source of a trigger, a source of fear or confusion. Okay, so we want them to know we're there to protect them. We want to make sure they're safe. Give them a hug, give them reassurance. Okay. We definitely want to talk to the doctor and let them know, because there could be potential medical causes for hallucinations. Okay. The person could have a urinary tract infection. They could be dehydrated. Head injuries, if they've fallen recently, can cause hallucination as well. So the best thing to do is look for patterns about when these occur. And then if something is happening at the same time of day, you're definitely going to look for environmental causes. But then also you want to come up with some solutions that will engage the person at that time in something that they really enjoy. So if you know that when it becomes dark outside, this becomes a problem, you want to increase the lighting in the house, have task lighting at the table, play a game of cards, listen to some enjoyable music, do something that the person is going to enjoy doing with you. All right, let's talk about another common challenge, and that would be confabulation. So this is really interesting to me. What happens is that the brain is subconsciously creating stories, and the person doesn't realize it. So they aren't aware that they're not telling the truth. So they have no doubt that what they are saying is right. So you might ask them how they got a cut or a bruise, and they'll make up something that has nothing to do. Sorry, my slides keep jumping ahead by themselves. They might make up a story and that has no basis in reality whatsoever. They might tell you something they did over the weekend that they didn't do, or describe a trip they never took or a place that they never lived. It is not, they are not doing this consciously. The brain is doing this all on its own. It's a very interesting phenomena. It's called confabulation. So confabulations are usually based in some kind of memory. The person's usually trying to fight to keep up some kind of facade of normality and being in control. So they might do things, their brain may do things like make up a little story to fill in the memory gap of something they can't remember. Okay. And it's really a creative self-defense mechanism that helps the person to keep up the facade. And they are going to be angry if you start contradicting them. They really believe about their confabulations, and they will often act on their confabulations. So be an active listener. Don't laugh at them. Don't try and reorient them. Just join them in their reality. Engage them in a conversation, and try and share pleasant stories of experiences that you've had. You could try and ask some questions and get a little more information nicely, not in a confrontational way, to try and get to the real answer. A lot of times I just wait and ask them again later, because I find then I'll get a different answer. Another common challenge that we have to deal with is accusation. So, look at this situation here. Somebody can't find their glasses, and she asks you, have you seen my glasses? And then because she can't find them, her brain makes up a story that makes sense to her. I think somebody took them, but they're in the bathroom, that she put them on the sink or on the counter before she went to bed, right? So you say, I think you put them on the sink. Let's take a look. She's not going to admit that she put her glasses there and forgot them. She wants to save face, whether she's doing this consciously or subconsciously. She's going to say, you must have done that because I didn't. She's going to become angry with you. She's going to accuse you of doing something that you didn't do. Again, this is not something that's happening on purpose. So get a basket or container that says glasses on the label, and then help her to develop a routine every night about placing the glasses in the container, okay, and putting them on in the morning. And this will allow the person to preserve their dignity as well as their independence, okay? You don't want to tell them that they forgot. It's just not going to help the situation, okay? And you don't want to get angry, okay? Sometimes we see people who have a reduced attention span. Maybe John's pulling out a drawer to put something away, and once the drawer is open, he doesn't remember what he's putting away. He's inspired by whatever he sees in the drawer and then takes everything out of the drawer. Okay? Or somebody who's beginning to set the table correctly, but then once she puts out the placemats, she might forget what she's doing. And then suddenly re-inspired, begins to pick up all the placemats and put them away. Okay? Or maybe your loved one likes to help make lunch, and it's hard to keep her on track. So once she has all the lettuce in a bowl for a salad, she thinks she's finished and walks away. This is just because the attention span of somebody who has dementia is significantly decreased. It's very, very easy for them to become distracted. It's difficult for them to filter out irrelevant stimuli in the environment. And so, they pull that drawer out, they forget what they were doing, they see something interesting, they start taking everything out of the drawer. They're not trying to annoy you on purpose. So when you see that, that is an indicator that the person needs something to do, okay? Give John sorting tasks that he would enjoy with items that are of interest to him. Have him do that, and then he might not be going through the kitchen drawers. But make a template for setting the table. So you have a placemat that has the knife, fork, spoon, plate right on it, and then the person could even follow step-by-step directions that you give them for setting the table. Okay, you could set one place setting that the person could use as a model, and then they could go ahead and set the rest of the place setting. I have placemats that I had made that are fabric that have the knife, fork, and the spoon embroidered on them. So we can just use those. They're washable. They're a cue about where everything goes, and then the person's able to be more independent. Or if you're making a meal, break those steps down. Type out a recipe in large print, take a photo of each step, and place the photo frame on the table in front of the person. When we can do these simple things that really focus on the skills and the abilities that the person still has, it allows the person to preserve their dignity. It lets the person it allows them to continue to engage in the things that they were used to doing at home. It takes us, yes, a little more time to write out the steps of a favorite recipe, or to create a special placemat, or to come up with some sorting activities. But I really think that it pays off in the end by empowering the person. So with someone like John, you could have a work table set up that they could spend time at the work table during the day, fixing things, polishing things, get some tarnished brass and some brass polish, get some dusty wood items out of the attic or the basement, and have the person clean them up. Put all of the silverware in a jumbled mess and ask the person to put it back in the utensil caddy for you. Obviously, don't show them that you're messing it up, but look for opportunities for the person to feel useful. And just remember, just adjust your expectations. If they can only work on something for 5 minutes and then they need to get up and leave and have a break, then that's okay. They worked on something for 5 minutes, they can get up and have a break and then come back to it again. We shouldn't have the expectation that they are going to have the attention span that they did before they had cognitive impairment. It's just not realistic. We're going to frustrate ourselves, and we're going to frustrate them if we set those expectations for them. So when we're having trouble communicating with someone who's living with dementia, it affects how we feel too. So think about some times that someone didn't understand you. How did you feel? You felt frustrated, probably sad that they've lost some of their abilities, maybe just totally overwhelmed because it's happened so many times. Hopefully we can get to some times where we feel compassionate and empathetic and patient. But there's certainly times where we feel impatient as well. And we have to try and put ourselves in their shoes as much as possible. Dementia makes it very difficult for someone to understand what's going on in their environment. It's very difficult for them to interpret what you're saying. They actually have an auditory processing disorder. And so they have to work very, very hard at making sense of what you're saying to them. Now, if we get angry with them, they're going to remember how we made them feel. They might not remember exactly what we said to them, but they're certainly going to remember how they felt around us. So studies have shown that people who are living with dementia are able to recognize nonverbal cues better than verbal cues because of the way that information is stored in the brain. Nonverbal messages are stored in the brain long before the hippocampus stopped working correctly. So believe it or not, a lot of times we can reach people better if we talk less. And I know when somebody is misunderstanding us, our gut instinct is to keep talking to them more. And with someone with dementia, it's better when we use gestures. It's better to provide information in writing. It's better to slow down and demonstrate something to them. They can watch us. And then if we model the correct behavior, they can follow along step by step, watching our physical movements. So a lot of times that is a much better way to interact with someone with dementia than trying to explain. You're just exhausting them. As one of my favorite sayings goes, it's like trying to teach a pig to sing. It's a waste of your time and it annoys the pig. So we need to slow down and talk less. Okay. Ways of communicating with someone that are pretty ineffective is speaking to them from behind. Okay. Instead, we need to place ourselves at the person's eye level. We need to make sure that we have their attention first by saying their name, and we need to make eye contact. Okay. Calling to someone from across the room is not going to be very effective. We want to address them by their preferred name, speaking slowly and loud enough to be heard while maintaining a very calm and respectful tone. I hate when people move someone in their wheelchair or they're providing care and they touch someone without asking or letting them know what they're doing first. So always, please let somebody know, and ask them before you move your wheelchair. We want to invite the person to do things with us, not tell them that it's time to do something, but give the person an invitation. Would you like to come and have lunch with me? Is a lot better than saying it's time to eat your lunch, or eat your lunch, or here's your lunch. So turning things into an invitation is a much better way of getting the person to join you. And then I like to thank somebody for participating or joining me. Sometimes when I'd like somebody to join in an activity, with me, I'll invite them and they might automatically say no because they're not sure what I asked. They're not sure if they want to do it. They're a little confused. So it's easier for them just to say no. So sometimes I'll say, well, would you mind just keeping me company while I do it? So for example, really simple example, if I'm hoping to engage someone in putting a puzzle together with me. And I say, would you like to put a puzzle together with me? And they say no. I might give them another choice. They still may say no. But I know that that's something that they've enjoyed doing in the past. So I might say, well, I'm going to take a stab at this puzzle today. Would you like to just keep me company? Would you mind just sitting with me? I could use some company today. And then I'll start putting the puzzle together, putting no pressure on the person at all. They might join in, or I might pick a piece that's pretty clear where it goes and say, I'm having trouble with this one. I'm not really sure where it goes. Do you think it goes here, or do you think it goes here? And see if I can get them to join in. Again, not putting pressure, and then thanking them when we're done. Thanks for keeping me company. Thanks for putting this puzzle together with me. I really enjoyed spending time with you. So they know that they're not going to be asked to do anything that's uncomfortable or that's confusing. That's really what I find why people refuse quite a bit, is because they do become confused and they're unsure. So we want to focus on what people can do. Okay? When somebody isn't understanding or saying no, we need to change our approach. Okay? They can't change. A person with dementia can't change. We have to look for familiar roles and routines in the home that they can engage in. Wiping the table, wiping the counter, making the toast, getting some things out of the refrigerator, washing the fruits and veggies, helping you match the socks, and invite the person to participate in these things with you, and just focus on what they're able to do. If it takes longer, it's okay. Okay? Think about the music that they really have enjoyed listening to throughout their life, and have a family member create a playlist for them as a gift, and make time. We've talked about the importance of music in other webinars that we've had during this brain health series. Make a personalized music list that the person can listen to every day. Break things into steps, okay? So take things one thing at a time. A task like brushing your teeth, to us, seems pretty simple, but for someone with dementia, that's a lot of steps. So we might just want to say, here's your toothbrush, or pick up your toothbrush, or turn on the water, right? And give them simple directions. I find that it's actually easier just to demonstrate with actions and not really to worry about the words at all. Okay? And letting the person know that you love them. They are very interested in showing, giving, and receiving affection. Okay? People living with dementia, even in the later stages of dementia, can read our body language. Okay? So make sure that you're holding yourself in an open manner. Okay? They can participate in familiar motor tasks. So they're going to be very good at helping you make the bed and wipe the table and set the table. Okay? They enjoy being creative and using their imagination. So embrace that. Do art, write poetry, listen to music, follow, demonstrate things for them. Reading is a preserved ability long through the course of dementia. They may not be able to read at the same skill level and speed as they always have, but they are able to read for quite a long period of time. So if you can provide simplified books, there's a source that I like quite a bit, and I'll type the website into the chat when I'm finished. But it's a company called Montessori Images, and the website is montessori-images.com. And they have a series of books for older adults with dementia that are intergenerational stories that are very nicely done. They're for adults, they're not kids' books. They have large print on one side and a high contrast illustration on the other. And then they have some activities also that go with them. These books have been tested with people with dementia. They are very effective. So if you have a family member with dementia, you might want to take a look and order a few of those books. So it's Montessori-images.com. And again, when I'm done, I'll type it in to the chat for you. And they can show affection and love. As I said, They want to give love and be loved. That doesn't stop. When you're communicating, there may be some challenges. Okay? Individuals with dementia will have some word finding difficulties. Once their semantic memory is impaired, they're going to have some trouble sometimes. And so listen, slow down, don't talk so much, and use the 20-second rule. When somebody's trying to think of a word, give them 20 seconds to find that word. Give them 20 seconds to answer you before you ask them a question again. Let them focus. Okay? That 20 seconds is a long, it seems like you try it, it seems like a long time to wait. Okay? If they still can't find the word, repeat back to them, okay, what they've said, and give them a chance to find the word. If they can't, you could try giving them a choice of the word that's missing, if you can think of it. You could ask them to describe it or tell you more about it. You could show them a concrete object and see if it helps to trigger the information. Another common challenge that we encounter is choosing not to bathe. A lot of times people think that they've bathed already, or they don't want to bathe for a number of reasons. Very often it's the water becomes uncomfortable. They can't see it, but they feel it. They may become very sensitive. They get very cold. They want to protect their privacy and their dignity. So there's a lot of reasons why someone may choose not to bathe. They don't want help, or they don't want to admit that they need help. Again, it could be a privacy issue. So it's good first to establish a routine of bathing at the same time. If the person usually took a bath or a shower at night, take a bath or a shower at night. Don't switch up the time. So ask about their preferences. Now, they have dementia, their preferences might change. You're just going to need to go with that. If they are refusing at night and all of a sudden they want to take a bath in the morning, go with it. Don't don't argue with them about it. Make the bathroom comfortable and safe and warm. So you could get a space heater, a towel warmer, turn up the heat, lay out the items so everything is right there. Okay, make sure there's a warm robe, play some music, okay, make it special. And then you don't want to argue, okay, you want to use positive reinforcement. So I was working with a caregiver a few weeks ago, and she said to the person, "You really stink. You need a bath." Okay, please don't say anything negative to the person. She had the best intentions, but it just made the person even more upset. You know, be happy. It's great to start the day feeling clean and fresh. Let's get cleaned up, and then we'll go have something good to eat. You know, let's get cleaned up, and then we'll go and visit your daughter, right? It's always nice to get into bed right after I've taken a warm bath. I always sleep better. Let's go why don't you go take a bath before you get in bed? Okay, so we're inviting and we're giving suggestions, but we're not bossing them around. Provide a chair or bench in the shower if needed. Let the person control the shower head. So instead of a typical shower head, you might want to change it to a wand so they can hold it. Okay, let them know what's happening for every step and follow their preferences. So if I polled every one of you, I know that you would say that you have a very specific way that you bathe yourself every day, right? I always wash my hair first. The first thing that I do when I get in the shower, I do that every morning, right? And then I have my whole routine. Well, everybody does. So we want to try and follow the person's preferences. You may need to wrap them in towels during the bathing process if they're getting cold. So if they're seated and they're washing their bottom half of their body, then you might want to wrap towels around their top half, okay, and then switch. If he uses extra towels, you have to do some extra laundry, but if it keeps the person warm and comfortable, then it's totally worth it. Another challenge, repetitive questioning. Okay, this happens a lot. And what we do is we answer the question. Well, answering the question isn't helping the person's memory. When we tell somebody the information who has a difficulty learning new information, it's going in one ear and out the other. So what you want to do is write the answer to the repetitive question on an index card in very long, large print, okay? Make sure the person can read it and understand it. And then when they ask, say, I have that written on a card right here for you. Lunch is at 11:30, and hand the card to the person. And then next time the person asks, instead of telling them, you say, let's look at the card. I think you have the answer there. And then they'll look at the card and they'll read it. And then you're going to practice that. Well, let's look at the card. I think you have the answer there. And eventually the person will stop asking you the question and they'll just look at the card instead. Okay? And it's very, I use this for lots and lots of things. They're asking to go home. They may live in a long-term care community. Saying this is your home now doesn't cut it. They know they're not home and they want to go home. Because they're seeking comfort. They're seeking their spouse. They're seeking something familiar. Maybe they're bored, okay? And they're thinking about, they're looking for something to do. Instead, ask them, what do you love most about your home? Listen to them. Look at family pictures, make them a memory book. We've had a brain health series on memory books. If you haven't seen that, you can go back and listen to it. Talk to them. What kinds of things do you like to take care of in your home? Oh, I like to do that too. Would you like to help me fold the laundry? Would you like to help me garden? Would you like to help me water the plants? Okay. So people who may not be living at home and they're living in a long-term care community, they need things to do. They need to be engaged in things that are meaningful and purposeful. They need roles and routines. That doesn't change just because somebody is living in a long-term care community. And then one of the best ways that you can communicate is to smile. Sometimes words aren't necessary. Okay, smiling is an involuntary response to things that bring us joy and laughter. But smiling can be a voluntary response. It can be a very conscious and powerful choice. So there's been studies that have confirmed that a smile is considered attractive to others around us. Smiling can elevate our mood. Okay? It makes us more attractive to others. Okay? It lowers our blood pressure. It makes us feel good. It makes us seem more successful to others. It makes us look younger. It helps us stay positive. Try even, studies have shown that people who smile regularly, they appear more confident. They're more likely to be promoted. Even if you're in a meeting that you're dreading, try putting on a smile at that meeting, at that appointment. People will react differently to you. Smile now, put on a big smile, and then try and think of something negative without losing that smile. Okay, it's hard. So even when a smile is unnatural or it feels forced, it sends the brain and ultimately the rest of our body a really powerful message. And it helps us stay away from depression and stress and worry. And it makes the people around us feel good as well. So when all else fails, give the person a big smile. A smile can definitely go a long way. So I'd like to be able to take some questions now. And I'm trying to get my camera back on because I noticed that there we go. So I have a question here in the chat. In dementia, recent memories are first to disappear, not to be stored, while old memories, such as from childhood, remain in our memory banks. Why? So that's a great question. The part of our brain called the hippocampus that is responsible for short-term memory and that initial memory formation is one of the first areas of the brain to be impaired in Alzheimer's disease and some of the other dementias. So areas of the brain that store our longer term memories are there. Those memories are stored in a different part of the brain, not in the hippocampus. So they're more accessible to people. We did do a brain health series on memory and how it works. So if you didn't see that, you can visit that for more information. Other questions?
I wanted to make sure you saw that question there, Jennifer. I'm looking, I don't see any other questions currently. You can feel free to click Q&A or chat at the bottom of your screen. But as Jennifer mentioned, the previous brain health series that Jennifer has conducted each month for us are located on the member portal on our website and available for you to access. So if you have any difficulties with that, please reach out to your care coordinator. They'd be happy to help you access those previously recorded sessions.
Any other? I'll wait for a minute or two. Give anybody who has any questions time to type them in. Just to remind everybody, I am available to support care partners and to support members who are living with cognitive impairment through Kendal at Home. I can conduct, even if you don't have a diagnosis and you're concerned about your memory, if you've been experiencing changes, you can reach out to your care coordinator. I'm happy to come to your home and conduct a cognitive evaluation and make some suggestions, let you know things that you should talk to your physician about, but also talk to you about strategies that can really help you to maintain your cognitive health for as long as possible. Dementia is not a normal part of aging. Memory loss is not a normal part of aging. And contrary to popular belief, there's a lot that we can do to maintain our brain health and to prevent dementia. So hopefully you've taken advantage of some of the other series. One of our very first series webinars was on prevention.
There's a question asking if there will be more Zoom sessions for caregivers.
We've been doing these sessions every month, and I'm hoping that we will be continuing to do them. And if you're not familiar with where the recorded sessions are available, you can get in touch with Marla or with your care coordinator, and they can explain to you where to find those on the Kendal at Home website so you can access them.
We have also recently begun in the last 2 months a support group as well, facilitated by Marianne Walker, our life enrichment specialist, to help offer support to family and caregivers of those caring for individuals with dementia. So if you're not already involved in that, please let us know. We'd be happy to get you signed up for those monthly support group meetings as well.
Yeah, that's really a great resource. It gives you an opportunity to kind of discuss some of the day-to-day challenges that you are having and you know, get some immediate answers and things to try. And it helps a lot to talk to other people who are in the same situation. You know, although each person experiences dementia very differently, it's nice to share things with each other that have worked, and hopefully, you know, be able to help each other, and just have a, you know, have somebody to talk to that's walked in your shoes. So I would encourage all of you to attend those support groups.
Okay. Well, as always, Jennifer, we appreciate you being here with us today, and we look forward to seeing you again next month.
All right. Thank you very much.
You.
Nice to be here. I'll see everybody next month. All right.
Bye-bye.
Bye-bye.